If you've been wondering when to start hormone replacement therapy or feeling totally overwhelmed by all the conflicting opinions out there, you are not alone. Many providers say you don't need it, wait until menopause, you're still getting a period, or it's harmful. Meanwhile, you're waking up at 3 a.m., gaining weight for no freaking reason, crying at the drop of a hat, and wondering what the hell is going on with your body. So today I'm going to give you a simple, no fluff answer to one of the most common questions I get. When should I start HRT? And even more importantly, how do you know if it's right for you? So, hormone therapy has become this weird battleground, if you will, between outdated research, poorly educated providers, and social media influencers shouting about pellets or shots. And us ladies, we are caught in the middle, feeling dismissed, confused, and often just told to wait it out. The biggest reason HRT still feels like a mystery is because of the Women's Health Initiative from 2002. It was a massive study, but it used women who were postmenopausal with other health issues and synthetic hormones. So the results were blown way out of proportion. And unfortunately, that study led to millions of women and their doctors to believe that HRT was dangerous, especially for heart health and breast cancer risk. Luckily, more recent research has shown that bioidentical hormones, those that mimic the same molecular structure as the hormones that your body makes, especially topical estrogen and oral progesterone, are not only safe, but actually protective when started at the right time. But that brings us to the next question. When is the right time? So if you are in your 40s and experiencing perimenopausal symptoms, this is the window, my friend. Perimenopause is the 2 to 10 or so years before menopause, and your hormones are already fluctuating like crazy. You know this because you probably feel crazy some days because of your symptoms. And listen, you don't have to wait until your period stops to start hormone therapy. That is outdated advice. In fact, waiting too long to start hormone replacement therapy, especially estrogen, can reduce some of the protective benefits for your heart, your brain, your bones, and your skin. Now, to be clear, you don't have to start HRT the moment you turn 40. It's not really about your age. It's more about your symptoms and your quality of life. So ask yourself, are you waking up between 2 to 4 a.m. and can't fall back to sleep? Are you crying for no reason or dealing with rage that feels out of character for you? Are your periods heavier, longer, or completely unpredictable? Are you dealing with anxiety that does not respond to your usual tools like yoga or meditation or deep breathing? Are you dealing with brain fog? You can't focus and your work is impacted. These are signs that hormones are declining, especially progesterone. For most women, that is the first hormone that needs to be addressed. So oral micronized bioidentical progesterone in a capsule can be a real game changer for many women when it comes to sleep, anxiety, and mood regulation. Now, if the FDA-approved capsule known as Prometrium doesn't work for you, you may need a compounded formula or a troche that slowly dissolves in your mouth. There's also the option to insert it vaginally or even rectally if when you take it orally makes you feel really groggy and sleepy the next day. The good news is there are a variety of options, dosing, and formulas to fit each woman. Then, as you get closer to menopause, when your cycles are starting to space out, estrogen is typically the next to be added. And that typically is going to be transdermal estrogen through a patch, gel, cream, or a spray like I use. And topical is considered the safest and most effective form. However, you can start earlier than that if needed. I personally started HRT before 40 when I was dabbling with all the over-the-counter low-dose options before I decided to get on some prescription hormones from my doctor. I had changes in my sleep, my mood, my periods. I was dealing with joint pain, anxiety, and brain fog. Like many of our clients, I didn't want to wait until things got worse. I mean, hello, look at what I do for a living. Could you imagine continuing down that path? I assure you, I would not be doing this podcast if I still felt that way. So most of the women that we support actually begin HRT between the ages of 40 to 45 because their symptoms start affecting their quality of life. So no, you're not too young. You just need the right information and support. The point is, you don't need to wait until things are bad enough. If your quality of life is declining and you've already dialed in sleep, nutrition, nervous system support, HRT is likely the missing piece. So how do you decide if this is in fact your next step? Ask yourself the following questions. Have I done the basics like eating enough protein and fiber, managing stress as best I could, creating better boundaries in my life, moving my body daily, hydrating properly? Have I ruled out thyroid or nutrient deficiencies? This is why we run an HTMA with all of our clients, as well as comprehensive blood work review, because midlife is not just about your hormones. We look at lipid markers to assess your cardiovascular health, inflammatory markers, immune health, and much more. Do I feel dismissed when I ask for help or just handed birth control or an antidepressant? If you are nodding along, HRT may not just be an option, it may be the thing that finally helps you feel like yourself again. And listen, it's not magic. I say this over and over at the risk of sounding like a broken record. You still need to support your body holistically, eating a whole foods diet, prioritizing rest, minimizing alcohol consumption, moving your body every day, assessing the stress in your life. Those things are not optional in midlife, because if you're not doing those things, your HRT probably won't be as effective and you may even feel worse. But when the timing, the dose, and the delivery method are right for you, it can be quite life-changing, as it was for me. So if you're in your 40s, feeling off and wondering if it's too early, it's not. In fact, this is the best time to explore your options, not wait until everything falls apart. We actually have clients in their 30s already starting HRT. So if you want to learn more, my Perimenopause HRT Roadmap course is on sale this month, and it's $100 off through July 31st with a special coupon code. I break down all the different types of HRT, what symptoms to look out for, how to talk to your provider, important testing to consider, and how to avoid the most common mistakes that women make. And if you want personalized support, you can also book a private session with me as an add-on. Everything is linked in the show notes as usual. Thank you so much for listening, and remember, you are not crazy, you're definitely not too young, you're just in perimenopause. All right, I'll see you next week. Hey, before you go, if you're resonating with this podcast and realize that your symptoms are anything but normal, my comprehensive program, the Perimenopause Method, may be a great fit for you. My team and I help women in their mid-30s to early 50s improve symptoms such as fatigue, disrupted sleep, anxiety, erratic moods, bloating, and much more. We do this by utilizing advanced testing, a personalized plan tailored to you, women's health and hormones education, and ongoing support so you never feel alone and you get results. If you're ready to commit to your health and feel like yourself again, but even better, check out the link in the show notes to learn more about the Perimenopause Method. The information provided is for educational and informational purposes only. I am not, nor do I act as a doctor or any other medical professional. I am not providing healthcare, medical services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional disease or condition. The information shared is not intended to be a substitute for the professional medical advice provided by your own medical or mental health provider.